Hello future nursing officers, welcome to your YouTube channel DNA Medicare Nursing Classes. Third space loss syndrome, or third spacing, is a medical condition. It involves fluid shifting in the body. Normally, fluid moves between two spaces, inside blood vessels, known as intravascular, and inside cells, known as intracellular. In third spacing, fluid accumulates in a third space. This space is the area between cells, called the interstitial space. This shift disrupts the body's fluid balance. It leads to problems because the fluid is not where it should be. Think of it like this. The body is like a well-irrigated garden. Fluid is like water, essential for each section to function. When fluid flows to the wrong area, it's like flooding a single part of the garden. The other parts don't receive enough. Similarly, in third spacing, the circulatory system, the body's irrigation, is affected. This can lead to dehydration and organ dysfunction, even if the person has enough fluid overall. During third spacing, the capillaries, our smallest blood vessels, become more permeable. Imagine them as tiny sieves. Increased permeability makes the holes in the sieve larger. This allows more fluid and proteins to leak out from the blood vessels into the interstitial space. This fluid shift occurs due to changes in pressure within the vessels and surrounding tissues. It's like squeezing a water balloon. The pressure forces water to bulge out. Similarly, increased pressure in the capillaries forces fluid into the spaces between cells. This fluid buildup in the interstitial space leads to swelling, also known as edema. The circulatory system is now lacking fluid. This leads to a decrease in blood volume and pressure, impacting the body's ability to deliver oxygen and nutrients effectively. Think of it as a traffic jam in your blood vessels. Several factors can lead to third spacing. One major culprit is inflammation. When your body fights infection or injury, it triggers an inflammatory response. This increases capillary permeability, allowing fluid to escape into the interstitial space. Another cause is low albumin levels. Albumin is a protein in our blood that acts like a sponge, holding onto fluid within the blood vessels. Low albumin, often seen in malnutrition or liver disease, reduces this holding capacity, leading to fluid leakage. Certain medical conditions like heart failure, kidney disease, and sepsis can also disrupt the delicate pressure balance in the circulatory system, contributing to third spacing. Additionally, severe burns and some medications can also increase capillary permeability, putting individuals at risk. Section 4. Recognizing the symptoms, a guide. Recognizing the symptoms of third space loss syndrome is crucial for timely intervention. One of the most visible signs is edema, characterized by swelling in the extremities, such as the legs, ankles, and feet. Patients may also experience a rapid heartbeat, as the heart tries to compensate for the reduced blood volume by pumping faster. This can lead to feelings of fatigue, dizziness, and lightheadedness. Other symptoms include decreased urine output, low blood pressure, and in severe cases, confusion and shock. It is important to note that these symptoms can be subtle in the initial stages and may overlap with other conditions. Therefore, if you experience any of these symptoms, especially after surgery, trauma, or during a severe illness, it's vital to seek immediate medical attention. Section 5. Treatment and management of third space fluid loss. Treating third space fluid loss focuses on addressing the underlying cause and restoring the body's fluid balance. Intravenous fluids are often the first line of treatment to replenish the lost fluid volume and support circulation. The type and amount of IV fluids will depend on the severity of the fluid loss and the patient's overall condition. Medications may be prescribed to address the specific cause of third spacing, such as antibiotics for infection or diuretics to remove excess fluid if kidney function is compromised. In addition to medical intervention, close monitoring is crucial. This may involve regular blood tests to assess electrolyte balance, kidney function, and overall hydration status. Early detection and prompt treatment are essential to prevent complications and improve patient outcomes. Section 6. Conclusion. Third space loss syndrome is a complex condition that disrupts the body's delicate fluid balance. While it can be caused by various factors, the underlying mechanism involves fluid shifting from the blood vessels into the interstitial space. Understanding the causes, recognizing the symptoms, and seeking prompt medical attention are crucial for effective management and prevention.